So when I do a consult, I always send like an intake form. So that kind of can prompt you about different things that you may want to ask. Or, I really dig deep to try to figure out your history. So that's the biggest thing is when you are working with a lactation consultant, make sure that they are gathering some sort of history. Most of us are, just to kind of, there's so much more than meets the eye with breastfeeding. We, got to make sure, like I said, with breast surgeries or different, how you got pregnant, how you make a baby can affect how we sustain feeding that baby afterwards.
You're listening to the Mommy Labor Nurse podcast, where you'll gain the knowledge and confidence you need to erase the unknowns of pregnancy and birth and rock the newborn days like a boss. My name is Liesl Teen. I'm a fellow mom, labor and delivery nurse, and your host. Each week on this podcast, you'll hear a mix of birth stories, expert interviews, and other fun pregnancy and birth-related content. As a reminder, anything you hear on this podcast is not medical advice. Please see mommylabornurse.com/disclaimer for more details. And now let's get into this week's episode. This week on the Mommy Labor Nurse podcast, I had the chance to talk with fellow Raleigh girl, Courtney Miller. How cool, right? I love talking to everybody, you know that, but it's just cool when you connect with somebody who knows, where Carrie is and knows where Durham is and all that good stuff. Courtney Miller has been a registered nurse since 2016 and is now an international board-certified lactation consultant, an IBCLC. Her passion for breastfeeding began after giving birth to her son in March of 2019, and she quickly realized there wasn't enough readily available breastfeeding education and support out there for new moms. Now she says she has found her calling of helping moms and their families along their breastfeeding journeys. Courtney regularly uses her personal breastfeeding experience along with evidence-based research to help educate and support the families she works alongside. Courtney is the face behind The Better Boob, also on Instagram. Inside the episode, I spoke with Courtney all about the benefits of virtual lactation consultants, and then we switched gears and did a total deep dive into the topic of tongue ties, which I know is something that a lot of you are curious about. And just, a lot of people have to deal with tongue ties. And before you have a baby with a tongue tie, usually you have no idea what they are or what's involved. There is so much great info packed into this episode, so let's get right into it. Wondering what you need to do to stay on track during each week of pregnancy? Not sure what you need to be learning or researching along the way? I can help. Sign up for our free weekly pregnancy series to get tips, advice, and resources tailored to your exact week of pregnancy sent straight to your inbox every week. Sign up at mommylabornurse.com/IamPregnant to get your first email today. See you in your inbox real soon. Hi, Courtney. Welcome to the Mommy Labor Nurse podcast. Thanks so much for being here today with me.
Hello. Thank you for having me. I'm super excited.
Yeah. Can you just tell our listeners a little bit about yourself, your family, where you live, what you ate for breakfast, anything you want to share?
Yes. So my name is Courtney Miller. I am a registered nurse. Prior to becoming a lactation consultant, I was a mother baby. Well, actually, in the very beginning, I was adult ICU and I learned a lot.
Yeah. I'm sure.
Learned a lot, but learned that it was not for me. And then moved over to postpartum, which my husband was military, so we've moved around a lot. And then went to labor and delivery, mother baby, had my first kiddo who turns 3 on Thursday, which is just... So
3 is such a sweet age too. It's a hard age. I'm not trying to scare you, but it's like their little brains just really, really do a turn. And it's just, it's so fun. I loved 3.
Yes, we have very much hit the 3s. So he's an awesome big brother. I just had my second. So I have a 3-month-old and a 3-year-old soon. Woo-hoo. So lots of fun over here. But after I had my first, I just really struggled with breastfeeding. he ended up having a tongue tie that was not revised correctly. So then we struggled with breastfeeding. I realized there was just not enough support. One day I just told my husband, I was like, I'm going to get my IBCLC, which is internationally board certified lactation consultant. My husband looked at me like I had 10 eyes and he's like, is this actually going to do anything? Like, because it's pretty, it's a lot of work and it's pretty expensive. So he was like, is this going to actually pay off? Like, he's the financial brain in our relationship. So he's like, are you sure? And I was like, I'm just doing it. I signed up, had all of my education and everything. And then COVID hit. So right before COVID hit, I actually took a job at a hospital on a postpartum unit being a lactation consultant. So in hospital. And then COVID hit and I, canceled all of our classes, all of our support groups, everything that we had for moms, it was just gone. So I found myself in a space where I was like, I really want to be able to help these moms. How do I do it? The hospital wasn't very helpful. Like I was like, oh, let me do this. And they're like, yeah, sure. Like they just kind of like brushed me off.
Yeah.
So I then just took it into my own hands and created an Instagram similar, in this kind of space that you are in with your mommy labor nurse, like along the same lines of just trying to get information out to families that they wouldn't normally get otherwise. And so then I would tell my patients like, hey, I've got this Instagram. I'm, putting tips and tricks on there. So that became the Better Boob. And then now that Better Boob has turned into my private practice lactation here. So we are just outside of Raleigh, North Carolina, right?
We are neighbors. We are closer than neighbors. Yeah. Love it.
So we moved here this past summer and like in 2021, summer 2021, and I just went full private practice. So it's been a crazy experience, but I'm my own boss now and I get to stay home with my littles and still get to help moms and be in that space. So it's literally a dream come true. I love my job. I love what I do. And that's
love it.
Me.
Love it. You are paving your own path. I love it.
Yes. I got finished with a workout today and then hopped on a Zoom call and then went into a consult and then I'm having this with you. So, it's been a crazy day, but in the middle, I've been able to be with my little ones and hang out with them. So, which I love.
I love it. Well, today, guys, if you can guess, since you are an IBCLC, we're going to be talking about lactation consultants and virtual lactation consultants. And then on the second half of this episode, I really want to do more of a deep dive into tongue ties because that is a common issue that moms have, babies have, and you have a lot of experience in because your first one had a very complicated one. So we're going to get into that a lot too. So can you start off and tell our listeners, like, what do you even do? Like, what is even the role of a lactation consultant for moms? Obviously they help with breastfeeding, but like, what are kind of all the hats that you wear?
I was just thinking about this the other day. I feel like lactation is such like a very specific term that I feel like I help out with so much more than that. Yes, I help out with breastfeeding, but I help out with really feeding in general. I answer a lot of questions. There are moms like lactation is just not limited to not breastfeeding. It can be open to pumping and bottle feeding and combination feeding and formula feeding. Like I can really help out with all of that. And I was thinking, I'm like, will they ever change that term? Like, because lactation consultants, we should, for the most part, know about really feeding the infant as a whole.
Interesting.
And I don't know. I'm like, would they ever change my title to, instead of lactation, would it be feeding? Or I don't know. But I feel like I can help out moms in so many other ways than just nursing at the breast, which I think a lot of people get that idea about these lactation consultants is that we only help if you are exclusively nursing. And we're really trying to change that. There's a big group of us on Instagram of the lactation consultants that we're trying to change that tone that we can help out with so much more. I sometimes feel like I am, a therapist because I'm seeing moms in their most vulnerable, part of our lives when we have these tiny humans that we're trying to learn to take care of. And so it gives me chills thinking about it because I do get to come in at such like a very valuable time and that I just cherish. So literally I try to help out with almost everything. I was talking to a mom today about birth control, like the nursing part in me, that being a registered nurse, I can still bring that in. So I can really help out with almost anything that you need. I will try to. And if I can't, I will find someone that can.
Love it. That's a good way to put it. Yes. And sometimes it's like you're like the first of the first. So if you're like, oh, maybe you need to see, an ENT, or maybe you need to go here, like that's a very, very important piece to have.
Mm-hmm. We kind of bring everybody together. I mean, It is like really
like a case manager almost.
Kind of, right? Yeah. I mean, and I find sometimes out in the community, there are some providers that don't see us as that part of it. Like we can still be lactation. Yes, is what I live, breathe, eat, sleep. Like it is everything that I do.
Yes.
When I struggled with my second, I recently, said that I have a 3-month-old. And when I struggled with him, we were in the NICU and we were talking about feeding and stuff. And I was like, I promise if there's anything, I've got the feeding part. Like this is what I do. And they're like, are you sure? I'm like, yeah, like, I'm a lactation consultant. Like, I got this. I will not let my kid not eat. Like, I got this.
Yeah. That is so funny. All right. Well, let's talk about like who should even see a lactation, or maybe some signs that seeing one is a good idea.
Yeah. So really, anybody can see a lactation consultant. I mean, I see so many moms post about, even if they are bottle feeding, whether that be with breast milk, donor milk, formula, there's still so many times that I comment and I'm like, hey, I can help you with that, bottle refusal. So yes, of course, the obvious breastfeeding issues. If baby's not gaining weight, if baby's not taking enough milk, if you are having pain, this isn't all about baby. Sometimes babies are gaining and thriving and the pediatrician's like, yeah, everything looks good. Yeah. And then the mom's like, but I'm suffering, I'm hurting. So really any aspect of, if you are pregnant or recently had your baby, you can definitely see a lactation consultant even before you have your baby. I've done lots of prenatal consults that we just go over and set a plan. Maybe you have some underlying risk factors, or maybe risk factors being like, did you have breast surgery, or have you struggled with infertility, or did you struggle with maybe your first baby breastfeeding? Those would be all things that I would say, get a prenatal consult so that we can best set you up for success. And, you may know a lot, but let's make a plan, an individualized plan. So signs that a consult would be necessary, I would say, again, any breastfeeding issues, weight issues, and really like when your mom gut tells you that something else is wrong and maybe everyone else is kind of shrugging you off. I get a lot of consults like that where they're just like, I've been to so many people and no one wants to listen to me. And your mom gut is never wrong. So if you're feeling like you need one, get one.
Yeah.
And lots of insurances are starting to pay for lactation consultants, which they should.
Yes.
They should. Some lactation consultants, especially in our area, a lot work at pediatrician's office. So your hospital may have one, but it goes to show, just like you have a provider, your pediatrician, you may seek out and interview different pediatricians. Lactation consultants are the same. You have to find someone that kind of vibes with you. And if you aren't feeling like you're getting your answers, definitely there's lots of us. There should be more of us. We're trying.
Yeah.
But reach out and try to find someone that best fits with you.
I love that. So here's a loaded question. What if you live in the middle of Alaska and there's nobody around to help you? What do you even do? Do you have even have an option?
Yes. So I have actually worked with moms from all over, from up to Canada down to the Bahamas.
Cool.
So, which is really cool because they, a lot of the times, so I do virtual lactation consultations. And with a virtual, a lot of people are like, how do you even do a consult virtually?
Yeah.
Especially for breastfeeding. But really when it's like, okay, one, it's like, if you don't have anybody else and it's either I struggle through this on my own, or maybe I don't meet my breastfeeding goals, or I have the chance of working with someone that can give me some tips. I promise I've got lots of things, lots of props. I've got crochet boobs. I've got I've got baby dolls. I've got everything to be able to show you through the screen. I honestly think that it's made me a better lactation consultant because I have to be there. I have to tell you through the screen how to position your baby or how to latch, or, and so it's made me over explain stuff. And so virtual lactation, especially with COVID, has really upped, like I said, insurances are also paying for this virtual, which I hope does not go away.
Yeah.
Because I just think it's, it's just a really, all of our stuff is moving virtual. Meetings, everything, Zoom is huge. So I have a software program that's like HIPAA compliant. So yes, you can breastfeed during the consult.
Cool.
To keep it all safe. It's even like higher than Zoom, if you're weird about anything like that. It keeps everything safe. We're in our own little portal. So I think that they can, the feedback that I'm getting from a lot of moms that maybe they just didn't get their answers, from other people, or they're in the middle of Alaska or the Bahamas and they just don't have anybody else.
Yeah.
That it's a good option to have.
Yeah, no, totally. I love that. You know what I was thinking too, while you were talking about that we're moving all virtual, like I know that Facebook or Instagram recently announced like a couple months ago, they're like going through this whole meta thing, right? So like everything's going to be 3D. I don't even know how that's going to work, but I'm like thinking, okay, maybe one day you can be a little more 3D and like you can be sitting in the same room virtually with somebody. Hey, that would solve a lot of problems, right?
Whoa. Yes. What does that be? That's like, I don't know if you've recently watched the show on Amazon Prime. It's called Upload.
No, I haven't.
It is like futuristic. And that reminds me of that because they can they put on their VR thing and then they're like in the room. And
that's what I'm saying. That's so funny.
It's going to be crazy. I
mean, the future is woohoo.
Yes.
That is so funny. All right. Well, let's talk about how somebody, if they're like, okay, let's do it. I got a consult scheduled. How can somebody make the most of that visit? What are some questions that they can ask?
Yeah. So when I do a consult, I always send like an intake form. So that kind of can prompt you about different things that you may want to ask. Or, I really dig deep to try to figure out your history. So that's the biggest thing is when you are working with a lactation consultant, make sure that they are gathering some sort of history. Most of us are, just to kind of, there's so much more than meets the eye with breastfeeding. We, got to make sure, like I said, with breast surgeries or different, how you got pregnant, how you make a baby can affect how we sustain feeding that baby afterwards.
Yes.
So it all kind of goes together. Definitely some things that you can ask, what your expectations are and what your goals, that's something for you to think about, like how, and you may not know the answer to these. You may not know, like, I don't know what my goals are. Like, I don't know how long I want to breastfeed. And that's okay. Knowing if you want to exclusively nurse at the breast, if you're going to be returning to work, if you're going to be doing combination feeding, kind of having like what your vision is for your journey can be very helpful for us on the other end. I try to lay it all out there and give you like all of your choices so that you can make the best choice for you and your family. Because I think that's very important, like to be able to nitpick and figure out, well, this worked for me. This did not. I'm going to keep this. I'm going to toss this away, or I'm going to hide this away for later. So I think that's the biggest thing. And again, finding someone that really works, that you vibe with and, can relate to and that you feel comfortable with.
Yeah, no, I love that. Do you often find that a lot of problems can be solved in just one session, or do you think it's like people need multiple sessions?
I think for the most part, around 2 to 3 really does, like an initial, and that may be an initial prenatally that best sets you up. And then one, maybe like if you do have some support in the hospital, then meeting with, the lactation consultant that you met with prenatally, meet with them maybe around a week or 2 weeks, just to kind of brush up on, okay, things are going well, because things just move so quickly and change so much that you could be doing well one week and then the next week it just crap hits the fan and you're like,
yeah, that's what happens.
And like your baby changes too, around 3 months. Like I have a 3-month-old now that's starting to get more distracted and look around. And then you think, okay, well, and they get more efficient. And then your milk supply is kind of changing too, because it's starting to regulate. And so there's just so much change that happens really in the first 3 months to 6 months. So I like to meet with people, initially if possible, and then follow up, in those first couple of weeks. And then if everything's going well, then maybe like before you return to work, if you're returning to work, just to kind of like have a plan and make sure that you feel comfortable pumping and all of that. So I usually say a couple weeks before you return to work, because you don't want to like get too close to that going back to work
tomorrow. What do we do? Yeah.
Yeah. So I like, initially out the gate and then, a couple weeks. And then depending on when you're going back to work, maybe that's 6 weeks, maybe that's 8 weeks, maybe a couple weeks before you go back to work. And then really, I've met with moms on like when introduction of solids happen, or maybe they're And I forgot to mention this earlier, weaning.
Yeah.
I can help with weaning too. I don't just
Yeah.
start breastfeeding. I can help with weaning too,
Yeah.
because that's a whole process as well.
Oh, it is. Yes.
So I've met with moms from all ends of the spectrum. They have a fresh 2-day-old or 1-day-old to, they've got an over a year old, and they're trying to figure out, how do I navigate this?
Yeah. Yeah. No, I love it. All right. Well, I think I know the answer to this next question, but if you have a partner, should they even get involved in lactation or these consults, or how can they even help with breastfeeding?
I think partners are so valuable to the relationship. I had a mom ask me this the other day. They're like, should my, husband, should my partner be involved? And I was like, as much as you want them to be.
Yeah.
If they want to, if they're that kind of person where they want to be involved, 100%.
Yeah.
But they don't have to be. So don't feel like you have to have that person there. But in a consult, it is nice to have 2 ears listening, because you're sleep deprived. You're going through a lot with your new baby.
Mm-hmm.
And, having another set of ears that when at the end of it, yes, lactation, I usually send a care plan afterwards. So it outlines like everything that you can be working on. But the partner can also be there like, oh yeah, I remember she said this about this, and let's try this. And, we all hear different parts of a conversation. So it's nice to have that second set of ears. And then especially if we're meeting like before, then they can, know what to expect in the hospital and where they can help. I mean, you're exhausted. You just gave birth to this beautiful baby. You're exhausted. You're not thinking about, I need to do skin to skin right now, or I need to try to get baby latched. You're just like, oh my gosh, I had this baby. So they can also honor your wishes. And I'm sure you deal with this with, birth plans and all of that. They can be that extra support and someone to lean on, and, hey, I'm struggling with this. Do you remember what she said, sort of thing?
Yeah. It's like
absolutely.
They're a support person, and they kind of help to fill in those gaps that you might have missed along the way, which happens, like you said.
And it's hard, partners. I know my husband feels like it right now. Like he can't really help with breastfeeding, because it is all on the mom for the most part. I mean, even if you're pumping, mom still has to pump.
Yeah.
So, dads don't make milk yet, or, partners don't make, sometimes can't make milk. So, having the mom be there, or the dad be there, or partner be there, can be very beneficial. And, helping out with so many things like burping the baby, diaper changes, those sort of things.
Yeah. No, I love that. That's great. All right, the sound of that baby crying means it's time for this week's segment of Birth It Up Babies. This is a short and sweet little third baby, she says. I just had my third baby. I really wanted to go unmedicated this time. My husband and I watched your Birth It Up Natural course, and he watched the partner videos on his own. He was so helpful, and I don't think I could have done it without him. Thank you so much for a great resource. Oh, I love that. So it's so great to hear that, you sit down with your partners or your support people and you watch the class too, because I mean, it's important to educate you guys as the one going through labor, but sometimes it's like equally important to educate your support person and the people that are in your room, because sometimes it's kind of hard to remember stuff, right? Like, you remember like one tip that I said, and if you have a fresh mind who's not having contractions in there, sometimes they can, like look up stuff and just remember things from the course to help. So yeah, love to hear that. If you want to check out the course that this mama took, she took Birth It Up, the Natural Series, and you can head over to mommylabornurse.com and click on the Natural Series. All right, let's get right back into this week's episode. Well, let's switch gears to talking about tongue ties. So tell me, I know we kind of touched a little bit at first. You said you had a complicated relationship with tongue ties with your first one, but can you go into more detail about that? Why you are a little more passionate about tongue ties?
Yeah. So my first, he had a very clear as day tongue tie. It was funny because we took a birth class. This is down in Georgia. We took an in-person birth class, and it was in person instead of like 6, I think. And one class, we literally talked about all about tongue ties. Like we just got on the topic. And so on the way home, my husband was like, I don't want to ever hear about tongue ties again, because like, I remember this, because we had talked about it for like an hour. It was just like one question after another.
Yeah.
So then I had my son, and my husband was actually able to help deliver. So my midwife was able to like kind of coach him, and she stepped aside and he was able to help deliver. So he placed my son on my chest. I didn't know the gender. So he announces it's a boy. We are both shocked because we didn't know the gender. I totally thought it was a girl. And so I'm still comprehending that I just, one, had a baby, and two, I had a boy. And my husband goes, he has a tongue tie because he's laying on my chest. He's laying on my chest and he's screaming. And that's a way that you can kind of see if they have a tongue tie, because, and not all tongue ties, I'll get to this, but not all tongue ties. It's not about appearance and it's not about how it looks. It's, I'll go more into that, but some you can see clear as day. And he's like, he has a tongue tie. He has a tongue tie. And I'm like, what? Wait, can we go back? Like, what just happened?
That's hilarious.
It was just like kind of full circle. Like we talked about this, and then it was he had a very severe tongue tie. So his was almost to the tip of his tongue, and his tongue was pretty much heart shaped. Like you could not miss that anywhere. So in the hospital, the pediatrician came to me and she said, hey, I can go ahead and take care of this in the hospital. I said, great, that sounds wonderful. I said, what does that involve? She said, it's just snipping underneath the tongue with some scissors, sterile scissors. It hardly bleeds. You won't really know you won't, we're doing it so early, you won't really know difference. So I said, okay, great. Breastfeeding initially right out the gate was pretty hard because I had inverted nipples, which does not mean you can't breastfeed. That's a myth. But I had some inverted nipples, so some, challenging ways with that. He was 37 and 3, so he was a little bit early. My water broke on my own, but he just decided he wanted to come a little early. And so we had those struggles, and then with the tongue tie. So I was given a nipple shield, which I kind of thought I might need just with the inverted nipples and everything that was going on. So we got a nipple shield from the beginning, and then it just took forever to wean that nipple shield. It was so painful to nurse him still. And I never even thought twice about the tongue tie because I was like, oh, well, we got that corrected. Around 2 months, we struggled with weight gain, milk supply, and all of those things are really red flags for tongue ties. And I didn't know it at the time. Then we went through is this a dairy intolerance? He was so gassy and his belly just hurt all the time. It took us forever to wean that nipple shield. I'm talking we didn't wean the nipple shield until closer to 3-4 months. I mean, it was and I just was doing everything. I was going to the support group every week with the lactation consultant. She's like, yeah, I mean, and there wasn't really much guidance with it. So that is how I became so passionate. Really, I didn't know it at the time, but then when I struggled so much with it, then went into, getting my IBCLC. I then reached out to, so we were in Georgia at the time. I reached out to this doctor. His name is Dr. Baxter. He has the Alabama Tongue Tie Center. He's written a book. It's called Tongue Tied. So he's kind of like this guru. And I was like, oh, I need to know more about this, because in my lactation courses, everything that I'd done to prep, they really didn't talk about tongue ties. It was just kind of this is what a tongue tie is. It can affect breastfeeding. Didn't really go into detail, and just kind of ended it there. So I reached out to him and I was like, hey, I would love to come shadow you. Just come to your practice one day. He was about 3 hours from me, but I was like, you must know because you are the guru. You've written a book about this. You've done your stuff. So I went over and spent an entire day with him. He's a pediatric dentist and he revises tongue ties with a laser. It's called a CO2 laser. So very different than what my kiddo had initially, which was a snipping with scissors. So at the end of that, I was like, we're going through all the symptoms. So I've talked about that, the symptoms of a tongue tie are more so important than the appearance of it, because it's the function of the tongue, not necessarily the appearance of it. And after talking to him more, I'm like, I think my son has, he was about 18 months at the time. I was like, I think his tongue tie was not revised correctly. So they didn't unfortunately get it all. When we do, in some cases, the clipping with scissors can be beneficial, but they have to be really, really good at it. Whereas the laser is more precise and it's really, for lack of better terms, it cauterizes that tissue, but it doesn't go deep enough. It can just get that top layer of the fascia underneath the tongue and make the tongue have more room to expand to the palate. So we were having trouble with my son's speech. I talked to the pediatrician about it. Use your tongue to talk. We were having some speech issues. We were having some picky eating, and all of those things can be signs of a tongue tie. And so I then, I went home. I then am looking in my son's mouth, does he still have one? And I was like, he does. And then I was like, that makes sense why he's having trouble with speech. So we ended up getting his redone around 18, 20-ish months with the laser.
Okay.
And I tell you, within a week, he was saying different words that he had never even attempted.
Oh my gosh. That's
It's
crazy.
very fascinating. Dr. Baxter has even said that he's dealt with kids that are like borderline, like they think these kiddos have like autism or ADHD, like attention, they're nonverbal, they're not talking very much. They've been to some speech language pathologists will actually pick up on tongue ties because, again, it's with the tongue.
Yeah.
And he's actually noticed like they'll come to him, he will revise their tongue, and then they're like, their hyperactivity is actually decreased. And he thinks that's so the tongue position also helps when you're sleeping. So these kids, they're having to move around so much because they're not able to sleep properly because they're not breathing, because our tongues should be at the roof of our mouth behind our two front teeth. When we're at rest, that's where it should be. Well, if our tongue's restricted, it can't go up there. So it typically sits down. And when you're in the laying down position, then it kind of slides back, not into your throat, but it can kind of cause some like sleep apnea, sleep obstruction. So these kids aren't sleeping at night, and then they're given medicine to kind of ramp them up because they're given, like a stimulant because they think, like ADD medicine should. And then, so we're doing that, and then they're still just not sleeping. So then it's just like causing this continuous cycle. Yeah. And then they start sleeping better because their tongue tie is fixed. And then they start speaking better because their tongue tie is fixed. And it's kind of like,
Wow. Interesting.
So it's very, very interesting. He's done a lot of research on them. And then, of course, then you go back and ask her like, oh, did you breastfeed? And they're like, no, I couldn't because it hurt so bad. Mm-hmm. Or they wouldn't latch, or they had weight problems. So then you start like all of these things were symptoms from the very beginning. We just didn't recognize them because there's really just honestly not enough people that know about them, or they think they're fads, there's a whole thing. So
yeah, that's like, I hate that like argument that, they're getting more popular because it's just,
we are diagnosing more because we know more.
Yeah,
when we know more, we can do more and we can prevent these things. So, I get the question all the time, well, is a tongue tie going to, if I don't decide that if my baby does have one, but I don't decide I want to fix it because it is elective. Yeah. Can my baby live a full life? Yes. Tongue ties are not, they're not going to be harmful in that way. We adapt as humans, as we compensate, we adapt, we move, if we're struggling with something, we move forward with it and find a way to make it happen. So no, your baby doesn't need it done, but it's definitely good to get an evaluation with a lactation consultant or like an SLP. As a lactation consultant, I cannot formally diagnose, so I do refer to like a pediatric dentist. I find that pediatric dentists, that's the key there, are the best people to revise these and assess for them.
Yeah, that makes sense. So when we talk about evaluation, you're saying that if you suspect that your baby has a tongue tie, maybe you start off with you like a lactation consultant, but you could get a formal evaluation from, you're saying, a pediatric dentist, or even don't ENTs diagnose as well?
ENTs do. I have found a lot of ENTs, for the most part, where I've lived, and this isn't everywhere, ENTs do a lot more of the scissor cutting rather than the laser.
Okay.
And they don't normally, so with tongue ties, there's so much more to it than just the revision. There's some pre-work that can be done. I always, even if I suspect a tongue tie, I tell the parents, I'm like, hey, this is what I suspect, this is what I'm feeling, but let's try to work on positioning. Let's try to work on latching. Let's see if we can get you more comfortable, which may be an option, may not. Let's wait and see. We're not going to do anything if it's not a problem. If it's not broke, don't fix it.
Yeah.
Sort of thing. But I have found that ENTs typically will do scissors, and then they, at the other end of that, they don't give what's called stretches. So after we've done this revision, there is going to be a scab underneath. There's going to be a wound, and that wound will want to fuse back. Our body wants to heal. So that's going to want to fuse back together. So we have to do stretches. And unfortunately, those are the worst part for me, in my opinion. It's so hard to do the stretches, but they're very important to make sure that that doesn't heal tighter or back together. And some don't get stretches because they just think, oh, I'll just do a snip, and then, we're done. And in that case, they either don't get all of it, like I talked about with my son. So I use this analogy. This is from Dr. Baxter. A tongue tie is like if my two fingers were stuck together. So they're fused all the way up in the center. They're stuck together. One finger, two fingers or one finger. So cutting it would only maybe cut to like maybe my knuckles. And yeah, I would get some movement there, but I wouldn't get all of it. Whereas the laser is more precise and can really get all the way down and separate my two fingers completely. And so that's the difference between cutting and laser. Now, I have met some providers, very, very, very few, that can cut it and cut it correctly, but you kind of want to do some background on them. Do they do stretches? Do they have follow-ups? Because those are the people, if we have, the biggest thing is stretches. If they have a stretches and follow-up program, then they clearly know the research behind that the stretchings are very important. So if they just say, oh yeah, we're just going to cut it and be on your way.
Bye-bye. Yeah.
Yeah. Or if they, a really big thing is working with a lactation consultant afterwards, because we have to reteach that tongue how to suck efficiently, how to remove milk and work efficiently. The tongue is a muscle. And as I said before, our bodies want to compensate. So the tongue compensates, and it's not always in the best way when we have a tongue tie. So once we've done that revision, we have to kind of reteach that tongue to work efficiently. So we work on sucking exercises, and working with a lactation consultant can make sure that you're moving in the right direction. For the most part, I don't see like full, some people will say they went in and got their tongue tie revision, if it was with a laser or whatever, and they immediately had great results. Baby was nursing and all their pain was gone and like the heavens opened and hallelujah, everything was good. Very, very few people actually say that. So I find in my experience that it usually takes about 3-4 weeks after the revision to fully get the tongue
benefit
to work
of it
properly. Yeah. And it's kind of like moms get discouraged. I even got discouraged with my second. My second had a very severe tongue tie, and I got it revised in a week, but we didn't get in our groove until probably like 7 or 8 weeks, because it just took us a time to make his tongue work better. And I'm a lactation consultant, so like I have all the tricks, but it just took him a little bit longer. So the 3 to 4 weeks isn't a hard and fast. It's more so, we just have to work with the baby. And that's why it's good to have the support of a lactation consultant, so you can, help me.
Yeah.
Did I make the right decision? Because, it's hard, because we don't want to put our baby through pain. And we're like, is this worth it? Am I going to see the light at the end of the tunnel?
Totally. Totally. I love that. And this is so great too for new moms, because again, like you said, tongue ties are so common. And so I didn't even know that. I thought it was literally the only option was snip, snip. That's what you think when you think of a revision. At least that's what I do. So I didn't even know that there was this laser option, and that you're saying that it's like so much better. And if they are snipping, to make sure that you ask these follow-up questions, like, oh my gosh, this is like, I'm glad that you're shedding light on that.
Trust me, I thought the same exact thing when, I had my first. I'm like, oh yeah, this is, this will be an easy fix. I can get it done in the hospital. I don't have to, and with, some people, there's not providers that do laser everywhere. So some people do have to travel like 2-3 hours. So you're like, oh, I can just get it done here at the hospital and I don't have to travel, but not all providers are created equally, unfortunately. And so doing your research will really, I've worked with a lot of moms that I've had, we've done a snipping and then we have to go back and do the laser because it didn't get it all. And so then you're working through scar tissue, and it's just, then we're putting our baby through 2 procedures. So, and it happens. Like I had to do it to my son. So I get it. But the more we know, the better we can do.
That's right. That's right. So we've talked a little bit about like the aftercare and these stretches and stuff, but what are some of the things that moms can look out for, like in terms of feeding, how baby's acting, like afterwards?
Yes. So are you talking about like aftercare or like symptoms that we should look out for?
I would say kind of let's do aftercare first and just how baby's acting. And then, we can talk about like if symptoms. For some reason they're doing this, make sure you call.
Yep. So aftercare for the most part, so I tell this story all the time with my son that was 20-ish months when we got his revised with the laser. So the laser's very fast. It's the whole procedure is really done. And like the lip, if we've got a lip tie, so there's lip ties and tongue ties. If there is that, then it usually takes about 10 to 15 seconds of the actual laser time. It's very quick.
Cool.
It's a lot of like stretching too. So they're applying the laser and they are cauterizing that tissue, but they're also like stretching it as that. So it's kind of allowing the tissue to do its natural thing. So The procedure is actually very quick. Most providers will use a numbing medication. I relate it similarly if you've heard about circumcisions. With circumcisions, you do a little bit of numbing, then it's along those same lines. And with that, I will say the hardest part is them just being in the baby's mouth. That's what I found. I watched my eldest, get his done, and he just didn't want people in his mouth. So I find that with any baby, we're stretching and we're, in there and they're screaming. So that's that aspect of it. But the procedure is relatively quick. And then after the procedure, that laser does kind of it cauterizes some of those nerves. So they do get a numbing effect from not only the laser, but the numbing cream. And so they're usually back to their normal selves within 10 minutes after they kind of just calm down.
Good.
My son got his done. He was scared, crying. They had a little playground outside. My husband took him out. He was eating goldfish within 10 minutes of getting the procedure. So I was he couldn't really talk at the time because, again, that's what we were struggling with. So he couldn't tell me that he was in pain or not. But like I said, he was eating goldfish. So I'm he clearly wasn't in that much pain because he's okay, we're cool.
Yeah.
He went to daycare the next day. So it's a very we didn't hold him back. Babies will typically be a little bit more fussy. It's just uncomfortable, especially around those stretches. We're going in and we're dealing with that wound. So lots of skin to skin. I tell moms, when in doubt, do skin to skin. If you can get in the bath with baby.
Good
with
tip.
My second, I had a C-section, so I couldn't, and we got his done around a week. So I could not get in a bath. Yeah. And he was just so fussy one night. My husband got in the bath with him.
Oh, yeah.
So it doesn't have to be, it can be your partner. The water's just warm. It's soothing. Doing some skin to skin. Skin to skin can actually just reset all of that central nervous system. So when in doubt, do some skin to skin. You may expect some breast refusal, maybe some bottle refusal, just their mouth hurts. So that's where you can meet with a lactation consultant, as well as talking with who does your procedure, because they should have some tips on how to, we can do a little bit of frozen milk. If you've got some frozen breast milk, but we only want to do that for the first night or two because we don't want to delay any healing. We want it to heal. So we don't want to do too much cold, but really skin to skin is my answer. If a baby is upset, just put them skin to skin, hold them, cuddle them, wear them. But generally speaking, they recover pretty quickly from these things.
That's awesome. And what about what are some signs to look for if maybe you need to go back, some worrisome signs?
Yeah. So there's very minimal bleeding. So, because if it's done with a laser, very minimal bleeding. I have heard horror stories with clippings that they sometimes go too deep and then we hit. And so the laser, like I said, is just so minimal that healing, there usually is a scab underneath if you get a tongue and a lip, there's a wet scab. So it kind of looks like, if you skinned your knee when you were little and then you get in the bathtub, you see that white.
Yeah.
So that's what develops. It'll be this white kind of scab. It'll kind of hang out on there. You will still stretch it, but it usually hangs out for about a week or so. And then it just kind of falls off. Normally they just swallow it, which is really gross to think about, but
hey,
you may not see it come out. You just are doing a stretch one day and you're oh, okay, it fell off. So that's just like any scab. It just covers that, kind of a little Band-Aid, keeping that area protected. So really excess fussiness to the point you can't calm them down. If they are completely refusing to eat, sometimes moms have to take a break from breastfeeding and just give some bottles. I had to do it. My kiddo went through a nursing strike. He was hey, my mouth hurts. I don't want to nurse. So we just did 24 hours of just pumping and giving bottles. And we kind of just did a reset.
Yeah.
So that's a possibility. But that's why I reach out to a lactation consultant. You don't want to go through this alone. Reach out so that, especially if you're feeling something is wrong, your mom gut, get some help to answer, why that's happening.
Yeah, I love it. I love it. Well, this was so great. Any final thoughts, advice, resources, maybe for that new mom who just had their baby and they are just, exploring the breastfeeding life?
Yeah, the biggest thing, and I say this all the time, breastfeeding is not easy. If breastfeeding was easy, I wouldn't have a job. I wouldn't be a lactation consultant.
Yeah, true. Yeah.
So know that, even though breastfeeding seems like the most natural thing and it seems like things should just be clicking and that you you put baby on the breast and they just nurse and everything is rainbows and butterflies. It's not. I've been through the trenches with mine. And like I said, I'm a lactation consultant. I had to reach out to another lactation consultant and be like, hey, I need help because I've got my mom hat on. I don't have my LC hat on and I need someone else to come in and help me. So yeah, just knowing that and knowing that it gets easier. It will get easier. You will get in your groove. Breastfeeding is very much a skill, and it's something that just like any other skill, it can be hard at first and awkward and like, I don't know what I'm doing and stressful. And then once you start learning that skill a little bit more and learning your baby, you kind of can get in a groove. And if you don't get in a groove, reach out to a lactation consultant that can help you because that's what we're here for. I want to help you. I don't want you to struggle like I have done. Like I want you to get the help. So that's my best piece of advice. Get help if you feel like you need it.
Love it. Love it. Well, I know everybody who's listening to this episode is now obsessed with you because you have done such a great job explaining all of this stuff. So where can they find you on Instagram if they want to follow you?
Yes. So I am at The Better Boob is my handle. The Better Boob is literally my fourth child, I guess, if you count my dog. I am obsessed with, I'm sure that's kind of how you are.
Oh, yeah.
You love just helping moms and I love getting the messages and helping in any way that I can. So I try to put out tips and tricks. If you have any further questions and want to shoot me a message, I can't give I can't give
medical advice. Yeah.
Medical advice or anything, but I can definitely point you in the right direction if I've got a post about it or if we need to set up a consult. Let's do that.
Cool. Love it. Well, thank you so much, Courtney, for joining me today. This was wonderful.
Thank you so much. Yes, it was great. Thank you.
All right, guys, that wraps up this week's episode. Thank you so much for tuning in and letting me be a part of your motherhood journey. It is truly an honor. If you like what you heard, don't forget to hit that subscribe button so you never miss an episode. And I love hearing what you guys think of the podcast. So if you're liking what you hear or you have a suggestion, I'd be so grateful if you'd go ahead and leave me a review wherever you're listening to help more mamas just like you find the show. What do you think? Are you starting to feel a little more confident about your pregnancy and birth? Well, if you want more, be sure to head on over to mommylabornurse.com/podcast for today's show notes and a library of episodes so you can keep getting educated before your upcoming birth. And while you're over there, be sure to check out the blog and learn about our online birth classes. Find it all and more over at mommylabornurse.com/podcast. See you next week, same time, same place.